My name is Katherine Pappas, and this presentation is going to be a literature review and analysis focusing on the topic of safe patient handling and why it's important in healthcare. Welcome. This PowerPoint presentation will explore current literature and studies that focus on education currently around safe patient handling and procedures. It will also explore ways for improvement. Safe patient handling is so important because every healthcare provider who works in an acute setting or at the bedside deals with the physical demands that come with patient care. The better educated the provider is, whether that be the nurse, physical therapist, respiratory therapist, or CNA, the safer the patient is, as well as the provider. Musculoskeletal injuries are much more common than one would think they are. They are actually the leading cause of injury among healthcare workers at the bedside. This is so unfortunate because this type of injury is very preventable. Research and studies have shown that factors such as employer involvement, proper training, and the use of mechanical lifts can help reduce and prevent such injuries. The research question that will be explored through this analysis is, what factors influence the use of safe patient handling methods in healthcare, and how do these factors affect patients and healthcare workers? CNAs and PCTs are the group of professionals that are often doing the most hands-on care with patients. Because of this, they are often the profession that experiences the most musculoskeletal injuries, as well as direct nurses. Duties such as toileting patients, repositioning patients, transferring patients to chairs, and changing bed linen while the patient is still in the bed are all high-risk activities for injury if not completed using proper procedures. While the main focus is how to prevent injuries among healthcare workers, it is also important to know how to use safe patient handling techniques. Safe patient handling techniques and the improper use of them puts the patient at risk and takes away from the quality of the level of care provided. Many nurses actually are shown to end up leaving the bedside because of on-the-job injuries and risk with patient handling and feeling a lack of support. This number is statistically up to 20%. To put together the research to compose this literary analysis, there were a variety of methods used. Databases such as PubMed and the Biological and Clinical Sciences Journal were used as some search methods. Some limitations that were placed on the research was that the literature was published within the last 5 years, it had to be primary research, peer-reviewed, and quantitative data. Any research that was not in English or was secondary research and not peer-reviewed was excluded from this analysis. Different search terms were used, but some common themes were safe patient handling, ergonomics in healthcare, musculoskeletal injuries among nurses, reasons for nurses leaving the bedside, and how to improve patient care. While there is ample amount of research on this topic available, it was a challenge finding research that specifically checked all the boxes and requirements that were required of this presentation. A lot of studies published were older than the last 5 years, and a majority of the studies on the topic were meta-analysis studies that could not be used. The first article analyzed was a quantitative quasi-experimental study. The study used motion caption sensors to test the effectiveness of current safe patient handling techniques versus new training that was developed by a research team. The study used 4 nursing students. The nursing students were first asked to demonstrate patient handling maneuvers on a test subject in a controlled lab using the textbook teaching style. They then received training, which was developed by the research team, and were asked to repeat the patient handling maneuvers on the same controlled subject. The wearable sensors were able to measure the different levels of physical strain associated with the patient handling maneuvers. The study was able to conclude that by invoking core and lower extremity muscles, spinal strain and back injuries were reduced. There were 2 main maneuvers that were used in this experiment: the log roll of a patient and horizontal transfer of a patient. These are 2 commonly used patient transfer techniques at the bedside. When it came to the log roll, the textbook instructed the caregiver to reach over the patient, hold their hip and shoulder, and use the draw sheet to pull them. The updated technique designed by the research team instructed the subject to use a core activation exercise by using an underhand grip to grab the draw sheet. For the horizontal transfer of a patient, the textbook direction instructed the caregiver to use an overhand grip on the draw sheet. This puts increased strain and movement on the arms. The updated intervention by the research team suggested that the bed height was at mid-thigh level and an underhand grip was used. The goal was to take the primary strain off from the arms and utilize the core and lower extremities. Article 2 is a quantitative descriptive cross-sectional study based out of Nepal. It used a self-administered questionnaire to poll 115 different nurses on their knowledge of safe working behaviors and patient handling tasks. The average age of participants was 30 years old, and nearly two-thirds of the sample held a bachelor's degree in nursing or higher. Overall, the results of this study showed that a majority of nurses polled practiced safe patient handling techniques. The mean safety score was 3.5 out of 5, so the higher the mean score, the higher the safety behaviors. The study focused on how consistently and frequently the nurses were following safe patient handling procedures. A few instances that stood out on the questionnaire as being exceptionally low scored was if a patient was physically dependent, the nurses often failed to use a lifting device or transfer aid. And if no coworker was readily available to help with patient handling, the nurses failed to explore other options, such as waiting for a coworker to become available or using a lift device. There was a correlation between age and education in this study based on the submitted questionnaire. Nurses who were 25 years and older and nurses who held a bachelor's degree or higher both scored higher on the questionnaire and demonstrated safer patient handling reporting. Some flaws in this study include the lack of reliability in the research. Being that this was a self-administered questionnaire, it can affect accuracy if there was any false reporting by the nurses. Overall, the information obtained from this study can be used by nurses and management alike to tailor their knowledge and skills. Management can focus specific education methods and styles to certain age ranges and certain units worked in the acute setting. Like Article 2, Article 3 is a quantitative descriptive cross-sectional study. This study uses a self-administered questionnaire once again to poll nurses on their knowledge related to safe patient handling techniques and their knowledge when it comes to the use of assistive devices and mechanical lifts. This study differs from the prior study because it uses a slightly larger study population. Article 3 uses 200 nurses, predominantly male nurses. This study did show that overall the nurses reported having good knowledge on safe patient handling. 56% showed good knowledge, while 44% showed poor knowledge. Nurses using this questionnaire came from all different working levels. Staff nurses did demonstrate a higher knowledge than head nurses or charge nurses. This was an interesting discovery, but might be due to the fact that head nurses might not be taking a direct patient assignment every day as a staff nurse would. Even though this study was predominantly male, it did conclude that female nurses demonstrated greater knowledge on all topics regarding safe patient handling, and the study did not show that age and education were significant factors when it came to safe patient handling. Female nurses who had prior safe patient handling training and worked staff at an inpatient hospital all correlated with a higher level of knowledge on safe patient handling techniques. Outside of those factors, age and years on the job did not seem to correlate with a higher or lower safe patient handling knowledge. A notable gap, however, in this study is that this hospital is located remotely in Pakistan. Researchers note that because of this, the nurses working who were polled have a limited access to certain equipment and mechanical devices. The study notes that to build a safer work environment, it is imperative to improve nurses' knowledge. It is suggested that training focuses on the specific population of nurses that scored low in this study, and that training be provided specifically on mechanical lift devices as they're available. The main themes discussed in this analysis were education, safe patient handling knowledge, protocols and guidance, size of the study, and implications. When it comes to education, Article 1 was found to be inconclusive, as nurses used in the study followed strict instructions from either the textbook or the research team. However, in Articles 2 and 3, education was highly correlated with safer patient handling techniques. Nurses with bachelor's diplomas or higher were more likely to demonstrate proper safe behavior than those with lower education levels. Safe patient handling knowledge scored differently for each article. Article 1 demonstrated low safe patient handling knowledge, mainly because the study did not as much focus on education as it did the effectiveness of the wearable sensors. Education was inconclusive in Article 2, as the results given were 50-50. Article 3 showed that patient handling safety knowledge was good, as over half of the study demonstrated safe knowledge and handling. Overall, when it came to protocols and guidance, the articles showed a positive correlation. Article 1 concluded that there was a benefit to the wearable sensors and implementing ergonomic techniques and safety. Article 3 showed a good correlation as well. 71% of the study had prior standardized training in safe patient handling, which reflected in the questionnaire answers. Article 2 felt that safe patient handling would be more effective and widespread if hospital management took measures to standardize education on the topic. Overall, the 3 articles analyzed use a small research study. Article 1 only used 4 nursing students, Article 2 used 115 nurses, and Article 3 was the largest of the 3 studies, using 200 nurses. All 3 of these articles show that interventions are needed to improve knowledge and practice. To conclude, this analysis successfully shows that there is a need for improvement in education and compliance when it comes to safe patient handling among nurses. Standardized education and training from hospital systems, as well as stricter accountability, would correlate with higher safe patient handling techniques, leading to better outcomes for both nurses and patients. It must be noted that this analysis only focused directly on nurses and no other healthcare professionals, and was limited to a small, localized study size.